Hey, Wellness fam. It's Dr. Latoya Wells with Wells Legacy Health and Wellness, your favorite nurse practitioner, where we are creating a legacy of good health. Tonight, we're going to be talking about something that impacts millions of individuals, and it's something that often goes undetected. November is American Diabetes Month. And today we're going to be talking about diabetes and prediabetes. And one thing I want you to know is I want you to know your numbers before diabetes knows you. I've had patients come into my office, they're tired, they're stressed out, they're craving sugar, and they're having brain fog. They're not able to lose weight and they can't figure out why. And with just a few lifestyle changes, I've personally seen these individuals reverse prediabetes, reverse a diagnosis of diabetes because they put the work in and they made the changes in their lifestyle and in their diet that were necessary. They lost weight, they gained their energy, and they gained their power back. And as a healthcare provider, that is so empowering, right? To see my patients take action and make these changes and see things reverse in their healthcare. It's amazing. It's about awareness, it's about action. And as I mentioned, it's about empowerment. And it feels so good as a healthcare provider to see those changes happen with my patients. I want to ask you a question. Who here has a family member who has a diagnosis of diabetes? If you do, I want you to drop a yes in the chat for me. And let's break this down. What exactly is diabetes? How common is it? How can we stop it before it starts? And that's what we're going to talk about tonight. So let's talk about it. The truth about diabetes is that it's not rare. It's very common for individuals, a large percent of individuals to have diabetes. But there's a lot that we can do about it. And diabetes is not just about the sugar, right? The insulin. It's not just about that, the blood glucose. It's not just about that. It's about insulin resistance, it's about metabolism, and it's about lifestyle balance. And so when we're looking at statistics, statistically speaking, there are 38 million Americans with diabetes. 96 million have prediabetes. And 80% of prediabetes, those cases are undiagnosed. 1 in 5. So if you're sitting in a group with 15 people, 3 of those people have diabetes and don't even know they have it yet. 1 in 4 Americans, or 1 in 4 adults over the age of 65 has diabetes. And when it comes to the ranking of, the causes of death, diabetes ranked 8th in the leading cause of death in the United States. And again, you guys know I love my numbers, and I don't throw these out there to fear mongering, right? To cause anybody fear or doom and gloom. I just want you to be aware. And so, what do we do with these numbers, right? It shows us who's at risk. It tells us what we need to know about our potential risk for diabetes. And if we think about it, when we go back to that where I said 1 in 5, if we're amongst a group of our friends, our coworkers, and loved ones, 1 in 5 of those individuals could be walking around with diabetes and not even know it. Not even know it. To me, as a healthcare provider, that is concerning. That is concerning. So knowing your risk factors, who's at risk? Let's talk about it. So some of the top risk factors for individuals who may be at risk for diabetes, and I want you to take note of the ones that I'm going to mention, because if you have more than 2 of these, then you are at an increased risk for developing diabetes. So you're over the age of 45 or old, so you're 45 or older. And even now we look at younger individuals because we're seeing obesity rates increase. We're seeing high cholesterol rates increase in younger individuals, and we talked about that before. So usually people used to think of diabetes as an old person's disease. That's not necessarily the case anymore. Family history of diabetes, a sedentary lifestyle, meaning you're not getting up moving those 30 minutes a day, being obese or overweight, especially if you have that abdominal fat, right? You have that extra fat around the midsection. High blood pressure, high cholesterol. Women who have had gestational diabetes, meaning they were diagnosed with diabetes during pregnancy. And if you happen to be African American, Hispanic, Latino, Native American, Asian American, or Pacific Islander, you are at a higher risk. Now, if you check 2 or more of these boxes, 2 or more, you're at a higher risk for developing diabetes. But that doesn't mean that and again, it's not doom and gloom. It's so that you are aware, so that way you can put things into motion to make sure that you're able to take control of your health again. So, what are some of the signs and symptoms? In nursing school, I remember the 3 P's: polydipsia, polyphagia, and polyuria. So, eating, drinking, peeing a lot. They're constantly peeing, they're constantly thirsty, and they're constantly eating. And no matter how much they eat, no matter how much they drink, they still feel hungry, they still feel thirsty, and they're peeing a lot. So, what are some of the common signs and symptoms of diabetes? Constant thirst, as I mentioned, dry mouth, frequent urination, blurry vision, slow wound healing, meaning these individuals get a sore or scratch or get injured, and it takes a long time for those areas to heal. The numbness, tingling, pins and needles in the hands and the feet, unexplained fatigue or irritability, and in women, particularly women or individuals who are overweight and have a lot of skin folds, they may see recurrent yeast infections. For women, PMS changes and thinning hair. So one thing I want to bring to light is what's tricky is that many of these signs are subtle, right? You're tired, right? You're just thirsty. Maybe you didn't drink the water, like you were supposed to. But many of these signs are subtle. And some people often think that they're just tired or I'm just getting old. But early intervention can completely change the outcome. Like I said, I've seen individuals who were diagnosed with diabetes or pre-diabetes, and we partnered together on their healthcare journey, and things completely changed. I had a patient recently who came to me and had, for her physical exam, but her weight was one of her main concerns. And so we talked about different options and things of that nature. But this individual put in some work, y'all, and she has lost 20 pounds just by exercising, just by drinking water, just by changing her diet and doing the things that she needed to do. So it's possible, and you can do it, right? You can. I've seen it happen. When it comes to exercising, like for me, I was at a weight that I didn't feel comfortable. And so I just increased the amount of walking that I did each day. And I started walking 5 to 6 days a week, sometimes 7, anywhere from 3 to 3.5 miles a day. And I saw the weight drop, including the water, including eating right, and the protein and all of the things, right? So let's talk about the lab numbers and what they mean exactly. They're here to warn us. They're like those early warning lights. When you got to change your oil on your car, my car will tell me oil change needed in certain amount of miles. And then it'll give me another warning light. And then that final warning light comes on like, hey, chick, it's time to change this oil. And you still driving this car. It's time to change this oil. So, and I'm not making light of this at all, but they're early warning lights. They're early warning signs. So when we begin to see those numbers increase, it increased. Okay, we need to do something about it. Okay, it's a little bit more elevated. Okay, we need to do. Okay, we're at a diagnosis of diabetes. We didn't listen back here. So fasting glucose. Fasting glucose means that you have not had anything to eat or drink anywhere from 6 to 12 hours prior to you getting the blood work done. And it just depends on the lab in terms of how long you need to fast. Me, I always say 8 to 12 hours, right? Normal is 100 or less. I'm sorry, normal is less than 100. Pre-diabetes is between 100 and 125 for fasting glucose. And then a fasting glucose that's 126 or higher is an indicator of diabetes. Now, you probably heard this number, and I've heard it called A1C, hemoglobin A1C, 3-month average, and that's exactly what it is. It's a 3-month look back at your blood sugars over the last 3 months. And they're calculated, and it gives us an average. And so anything 5.7 and below, anything below 5.7 is normal. 5.7 to 6.4 is indicative of pre-diabetes. 6.5 and higher is a diagnosis of diabetes. And so for my pregnant women who have to take those nasty glucose tolerance tests, I've had to take them. They're horrible. Any pregnant woman, you are going to have to take those glucose tolerance tests. And for me, someone who suffered from severe hyperemesis gravidarum, it was a struggle. And so Less than 140 is normal. 140 to 199 is indicative of pre-diabetes. And then anything 200 and greater is indicative of diabetes. The A1C number is a game changer. It tells you, again, 3-month look back. And I've had people that come into the office and I say, okay, you meet criteria, let's check your A1C. Oh, I ate such and such today, or I drank some coffee, or I drank a soda pop, or I drank this, or some, whatever. I don't call it soda pop, but I'm noticing that many patients that I've seen call it pop or soda pop. And so it doesn't matter what you ate or drink that day. It is a 3-month look back. And so once I explain that to them, they're like, I don't know, that number probably gonna be high. And there are some times where it is high, but then there are some times where it surprises us. And the A1C is the easiest way to catch problems early. And we can do it in the office at Wells Legacy Health and Wellness. It's a quick check, prick of the finger. Within 5 to 6 minutes, we have those results available. And before you leave, you know your numbers. And if it's high, then we're going to do some more labs to just confirm things, right? So type A1C in the comment if you've had your A1C checked this year. And if you know when you should be getting that checked, right? So at certain ages, we should be getting certain things checked. And A1C is one that should be done on an annual basis or every 6 months, depending on your risk factor. And if you plan to get it before Thanksgiving, right? We know we're going to be eating all that turkey, all the dressing, all the stuff on Thanksgiving, and the holidays are coming up. So it's good to know your numbers ahead of time. So that way you can monitor what you're eating. You can kind of pace yourself. Lifestyle prevention and things that we can do. And I talked about exercise, and I'm not going to go on my soapbox like I always do when it comes to the exercising, right? But 30 minutes a day of walking 5 days a week can cut your risk of developing diabetes by 58%. And if you have pre-diabetes, it can decrease that number and get you back into normal ranges just from walking 30 minutes a day, 5 days a week. No pills, no gym membership, just consistency. Getting out, hitting the pavement. That's all. You heard about my patient that I mentioned, and the amazing things that she's doing with her weight just by walking, just by staying active. And so food plays a big part in the development of diabetes and how our bodies process the sugar and things of that nature. So diabetes prevention is not about starving yourself. It's not about deprivation. It's about balance and awareness. You know me, I don't tell anybody they can't eat anything. If you want to have a piece of cake, fine. All things in moderation. So instead of a big slice, we're going to have a sliver of that cake. Instead of, we just going to have a spoonful, right? A fork, what have you. But just monitor things. So when you eat, your blood sugar rises. But the goal is to avoid those spikes, right? So when you don't eat throughout the day, it drops. Then when you eat, it shoots up. And then it drops again. So making sure that you're eating those 3 to 5 meals throughout the day is what I say. Instead of 3 big meals, we recommend 5 small meals throughout the day with some snacks and things in between. So it just depends on what your preference is. So making sure that we're avoiding those peaks and valleys and spikes with the blood sugar. So every meal should include lean protein, like the fish, the turkey, eggs, things like that. Beef, if that's your protein, chicken, if that's your protein, high fiber, so those beans, the leafy greens, the quinoa, veggies that are going to bring in fiber, right? Healthy fats, the avocado, the olive oil, the nuts that are going to give you those healthy fats that we've previously talked about. And then, of course, previous water. And of course, plenty of water, I meant. As we talked about previously, we should be getting at least half our body weight in ounces of water per day. Half our body weight. And put this disclaimer out there. If you are someone who has any conditions with your heart, or your healthcare provider has told you to monitor your water intake, do that. Take what I say, bring it to your healthcare provider, discuss it with them before you start anything. And when we're talking about the protein, it should be, the serving size should fit in the palm of your hand. That's your serving size, right? So your protein, the palm of your hand, carbs is a cup fist, and then fat is a thumb. So if you're looking at how much butter can I have, It should be no longer than the length of your thumb, right? And so that's how you, without having to weigh everything, kind of get a visual. Palm of your hand for your protein. Your carbs should be no bigger than your fist. And then the fat should be no more than the size of your thumb. And everybody's thumb is different. So, hey, meal prepping is something that I encourage, especially my patients who are looking to change what they eat and how much and how often they're eating. And those who, when they get stressed or they get busy and they forget their food, then they find themselves in the fast food line, which there's nothing wrong with that, right? But we want to make sure we're making healthy choices. And so by doing that, meal prepping, you already know what you have your serving sizes together, you're good to go. And then for those who like smoothies and things of that nature, there's so many different smoothie ideas and different food planning ideas and food prepping, meal prepping ideas that are available that can definitely be of help and assistance to you. Now, the mind and the body combination, right? You know, we talk about the whole person, not just the physical, not just the spiritual, not just the emotional, the mental, but all things. And so when we look at stress plays a huge role on our blood sugar. When our cortisol levels rise, our blood sugar rise. And when the cortisol decreases, so does the sugar. And so making sure that we are managing our stress is so important. So what are some of the ways that we can manage stress? And we've talked about this before, deep breathing. So practicing 5 minutes a day of deep breathing, whether it's in the middle of your day, the beginning of your day, or the end of your day. And then limiting the sugary drinks and the sugary snacks when you are having emotional moments. I know me, I'm an emotional sweet eater. So if I'm stressed, if I'm upset, I'm gonna go eat the cookies. And I'm not just eating 2 cookies. I may eat the whole pack of cookies. And so I know I just can't have cookies in my house. And when I do, I make sure that I am doing all things in moderation. And then tracking our sleep. Poor sleep increases our insulin resistance. So if you're having insomnia, my ladies who are dealing with perimenopause and menopausal symptoms, you're having insomnia, those who are stressed, you just can't shut your brain down at night because you're so stressed, your insulin resistance is increasing. And then practicing gratitude. You know, for me, I pray, I journal, I get out and exercise, I'm out in nature. Those are the things that help me. So what are some of the things that I want you to be aware of? What are some of the key points that I want you to take away from tonight's talk? Know your A1C, know your blood sugar numbers, know your cholesterol numbers. There's a lot of other numbers we should know, blood pressure, all those things, right? But tonight I want to focus on those 3. Choose a balanced diet, one that's high in lean protein and fiber. And then move your body at least 30 minutes a day. Movement is medicine, like it helps so much. And then stay hydrated and manage your stress. Diabetes is not inevitable, right? But it is preventable. And prevention starts with knowledge. So this information I'm giving you tonight is knowledge that you can then take and apply to your life. I want you to know that if you have not had your annual wellness check yet, if you haven't had your A1C, book an appointment with us. We at Wells Legacy Health and Wellness provide early morning, evening, weekend flexible appointments that are personalized to you, your needs, what you want, what you desire. We partner with you on your healthcare. And I'm just not throwing that out there, right? Because if you haven't gone to your healthcare provider yet, book that appointment. Go and make that appointment. But we have to make sure that we're making our health a priority and that we're not postponing things. These are screenings, things that can be easily done with the prick of a finger or a blood draw. And so if you need some resources, if you need help with tracking your blood sugars or tracking your numbers, DM me, put DM in the chat, and I will send you some resources, whether you're watching it live or you're watching on demand. And I will send you some resources to kind of help you to monitor your blood sugar. I want you to say this with me. I am in charge of my numbers, my health, and my future. This is Dr. Latoya Wells again with Wells Legacy Health and Wellness. Thank you all so much for tuning in to Wellness Wednesday tonight. Each and every Wednesday that we're here, For those who are my faithful followers, I appreciate you. And I just want to say thank you. Your wellness is your wealth, and your health is your legacy. And that's what we're here for. That's what we're about, right? We'll stand 10 toes down to ensure that our patients are creating a legacy of good health. Yesterday, we celebrated Veterans Day. And so I would be remiss if I ended this live without thanking all of those who served in the military, who gave their lives, their time, they sacrificed for us. And I'm grateful, right? I have veterans who are in my family. My husband is a Navy vet, and my uncle was in the military. There's so many that I know who have served in the military. And I have my sister is actively serving right now in the military, in the Air Force. And I'm so proud of her. I can't wait until she retires, but I'm so proud of her and for her dedication and her sacrifice. So to those who have served, those who've lost their life, those who paid the sacrifice of their life by serving our country, I honor and salute them today. And those who served in the military, I honor and salute you. For those of you who are currently and actively serving, we honor you, and I'm praying for each and every one of you. Right now, we're in a hard time when it comes to our military and the things that they're having to deal with. You guys know I don't talk politics on my page. I don't. But I just want those individuals to know that I'm praying for you. Again, guys, thank you all so much for joining for another episode of Wellness Wednesday. Stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, bye.